North Carolina with IBM TV, Bill Trezevant with IBM TV in Washington, D.C., Kimberly Calhoun with IBM TV in Raleigh, Durham, Sasha Starr, who heads up our television show Investing with Sasha in Toronto, Canada, and Miss Kumar, who's also in India, and Ankit, everybody knows him. He has 1.3 billion Facebook followers with IBM TV in India, and then Rakesh is out of China, and today, there's 1.3 billion people over there.
So,
and Rakesh is in
namaste
China.
everyone.
Yeah, namaste. We all learned that that's better than shaking hands. Tell us, how are you dealing with the coronavirus over in India? What's going on?
Well, I think just like everyone else is doing, we're just, at the receiving end of the thing. And we are trying our best to take all precautions, and the government is working very, very hard. Unfortunately, it's not producing much result. The reason being that the Indian population is so huge that no matter what we do, it will always be, overpowering, the disease will overpower us. No. Fortunately, we have been able to flatten the curve, but we could only flatten the curve. We could not reduce the area below the curve, which basically means that the whole thing has become more prolonged. The height is lessened, but the length is prolonged. As a result of which, the area, that means the number of people which would potentially get affected, would remain the same. Until or unless we develop some sort of a herd immunity, or the virus mutates, or we come up with the vaccine.
Right. Yeah, and Miss Kim has also joined us from California. Good to have you, Miss Kim. Namaste. We all learned that that's better than shaking hands. Dr. Sanjay, herd immunity, which I've heard, where just basically a lot of people get infected, and India, which has a growing amount of coronavirus. But don't you have a younger population? Because it looks like, to me, reading the mortality statistics, it's people that are older and people that have compressed immune systems, and in your country you got a lot of young people like in Africa, and so they can get it and go, okay, coronavirus, got it and gone.
So that's true that our population is predominantly young population, and as a result of which the disease is milder in younger people. It is more severe in older age group. It is the mortality rate is higher in older age group. Mortality rate is higher in people who got comorbidities along with it, like diabetes, obesity, hypertension, heart disease, asthma, chronic lung disease, and all. And India being predominantly young population, I think the mortality rate is lower. There's another reason for the mortality being low is that India started doing some empirical drug treatment earlier in the course of the pandemic. Those empirical therapies probably brought about some result in terms that they made the disease slightly milder. So we could avoid more severe forms of the disease. For example, the use of HCQS, which was very, very empirically started, but probably seems to be working. Then some antibiotics were started very, very empirically, like ivermectin, azithromycin, which probably seem to be working. And also the use of steroids was also started a little early. Hence, that is also helping. So all these things combined are resulting in probably a lower mortality rate. But yes, of course, a younger population is also a reason for a low mortality rate.
Yes, and so what you're saying is there's improved treatments. Yes, Mr. Bill.
Yes, doctor, I was wondering, because this is perhaps the dark side of it. The increased infections, and in order to get to the herd immunity, will mean increased deaths at the end of the day, even if it's 1% of those that are infected. Am I right in my understanding, or no?
You're absolutely right that if we do not have any vaccine, then the herd immunity will basically mean more infection. And more infection would mean that even if the mortality rate is less than 1%, the absolute number of deaths will be very, very large.
Okay, so that when you said earlier that you weren't able to flatten the curve, but you were able to stabilize the line, that would be the baseline and level of the infection rate at about 90,000 a day in India, which it's been at least for the last couple of days. And then we would be forecasting expected deaths based on that number. Am I right in that understanding?
Yes, I would say that we have been able to stabilize. Had the curve not been flattened, probably these numbers would have been much larger. So, India being not only a very thickly populated country, it's very widespread. So the number of cases are now spread across India. Though there are concentration is more on the big cities like Delhi and Bombay, because they are also the travel and financial hubs. But right now the infection is spread across India and the deaths are also spread across India. That's why the numbers are very, very high. Numbers are probably higher than what we get to here because a large number of patients are asymptomatic, and there are also a very high false negative rate, of every test. So the actual numbers may actually be more than what we are getting to see.
Yes, and doctor, I wanted to ask you specifically about that number, and that is this: it's not just for those factors cited, but it's also in the rural areas where having COVID-19 is a stigma, and people are fearful of seeking treatment, even getting a diagnosis. And so, therefore, would you say that the numbers are slightly undercounted, vastly undercounted? What multiplier would you add to the numbers? Is it likely twice or three times as much, doctor?
It's very difficult to add, the magnifier or minifier to it. But yes, we can safely say that the numbers that we get to know, or get to see, are much less than what actually may be there in the community for various reasons. Reason number one is that every test has got a very high false negative. Like RT-PCR has 30% false negative results now. The rapid antigen test has got 50% false negative results now. So we tend to miss out on diagnosing. Plus, all the people who got symptoms or their contacts are not really reporting, not getting tested also. For various reasons. One is that the tests either are not available in the periphery or remote areas, or there is a stigma and they don't want to get tested. So everything combined, the actual numbers may be actually much higher than what we get to hear, but it's difficult to say how much higher or what figure would that be.
Okay, thank you, doctor. Wow, Nick.
Yeah. I'm just concerned. What happens if somebody does get COVID-19? In other words, they go test and all of a sudden they test positive. What should they do next? Or if a family member gets it, what should they do next? What's the next step once you find somebody next to you or yourself is infected?
So the protocol that we are following right now here in India is that we see that what is the severity of symptoms, and what is the age of the patient. If the symptoms are mild, if the patient is younger and there's no comorbidity with that thing, then patient is asked to home isolate. And in fact, the whole family isolates themselves at home, and they are monitored constantly by either a government agency or a private agency. Then anyone who tends to develop more severe symptoms or who's at a higher risk, they are the ones who are admitted to the hospital.
Very sensible.
And that is the reason why also that we are able to manage large numbers quite well. Because earlier on, the policy was to admit each and every patient of COVID, but that has been changed. Now the milder cases are being treated at home. So home care is being managed. A monitored home care is being advised.
And what do you think about these things called face masks?
They are the only vaccine that we have right now.
Okay, so the thing is, you would recommend that people wear these when they go out, because over here we are wearing them when we go out. But I see some people that they take these and they ignore them completely. And aren't they playing Russian roulette when they're with a bunch of people and they ignore the face mask?
Fortunately, in India, at least in Delhi, which I have seen, everyone is wearing face masks. They may not be wearing the correct mask or in the correct manner, but they all are wearing. Even the poorest of the poor, the illiterate people, So I see everyone is actually wearing a face mask. It's rare to see somebody outside the house not wearing a mask. Of course, inside the house, nobody's wearing a mask. There's no need to wear a mask inside the house. Right. But outside, everybody has to. And the moment any outside person comes into your house, the person has to come wearing a mask, and we also wear our mask to meet some stranger.
Right. Yeah. Yes, Bill.
Listen, I think Rakesh and had some comments and thoughts. And go ahead,
Yeah.
Rajeev.
Yes, Rakesh, let's see what's going on.
Just a question about, because of the younger people being infected in India, because the population's skewed in age-wise. I am just wondering if there's any sort of initiative to see if there's any long-term organ damage for the next generation, the younger people who are likely to be in the economically productive zone, of the population. So I was just wondering if there's any sort of initiative either by the government or some kind of non-governmental organization to assess the kind of organ damage that younger people would face. Just wondering, I don't know. I'm delighted to hear that so many people are wearing masks because it's my home country, and I'm so happy to hear that. But I was just wondering if you'd know anything about that.
Okay, on that point, it is the older people, the older age group, or people with comorbidities and risk factors who are at higher risk for any organ damage, namely the damage to the lungs, damage to the kidneys, or anything else, even to the heart also. Younger people, as I said, mostly they have a milder disease. When they have a mild disease, there are no symptoms and there's no permanent damage also. Also, now with the changed treatment protocols, there's an early use of steroids. Initially, we were all scared to use steroids early in the disease because we did not know how the virus would behave. But now the steroids being used early, that is also preventing a long-term effect on the lungs or long-term damage. So the connective tissue damage which was happening, or fibrosis which was happening, that is being prevented with the early use of steroids. And also HCQS and other treatment modalities are also preventing the long-term effects. However, older people, people who are at higher risk, or those who are exposed to a higher load of virus, for example, doctors are exposed to much higher load of virus, they are more likely to get organ damage. And then in those cases, the organ damage potentially can be, long lasting also. But younger people, fortunately, are safe from that. And right now, the government is more concerned about curtailing the pandemic, controlling the infection, treating the patients now, and not much focus is there on the long-term thing because we don't really know how things will shape up in the long run, because this is the only experience about for last 6 months that we have now.
Thank you so much, Doctor.
Thank you.
Yeah.
And Dr. Sanjay, I would like to know, as a senior ophthalmologist from Delhi, what do you suggest, or what is your advice for the patients, especially for people who are suffering from COVID-19? Because will that affect in eyes at some point of time, or how they will protect their eyes during this pandemic?
So, as far as the eyes are concerned, first of all, the theoretically, the portal of entry into the body are three. One is the nose, the mouth, and the eyes. So the virus can enter through any of these routes. So we need to protect these routes. The nose and the mouth are protected with the use of mask, and eyes need to be protected with the use of glasses. Especially for people who are more at risk. So all the medical workers, and we do that, whether we wear a protective glasses or we wear a shield or the full PPE depending on the nature of work the person has. That's one aspect. Second aspect, in some people, COVID is showing up as a first symptom in the eyes. So typically it produces conjunctivitis, and strangely so more commonly in the left eye than the right eye. But conjunctivitis may be an early symptom of COVID. So any patient presenting with conjunctivitis, we have to be very, very careful. And if there are any other suggestion, any other symptoms, we test the patient for COVID also. Third aspect is for other patients who are coming for treatment to us, say for any surgeries and all, we are screening those patients for COVID as well, because we want to prevent cross-infection to others. And in the long run, we have not heard of anything. We don't really know that how will it affect in the long run. But if it acts like any other virus, which affects the eyes, the nose, the throat, probably there will not be any long-term adverse effects on the eyes. Also, we have seen a slight increase in some other conditions in the eye. For example, various inflammation in and around the eye. Things like scleritis, uveitis, periocular inflammations, optic neuritis have increased though we have not seen any correlation with COVID. It is just an incidental observation that in these days these conditions have been seen more commonly, but those patients have not really tested positive for COVID. So that's just an anecdotal observation that I'm making.
Mhm.
Dr.
Yeah.
Dhawan, can you use some kind of an eye drop or something to make sure that our eyes are clean, or maybe something which we can, like the way we wash our hands or protect mask from nose and all those stuff. So, is there any eye, some kind of a
No,
droplet
no,
which we can
no,
use?
no. There are no eye drops to help in any kind of protection or anything. I think just protecting the eyes from exposure to the virus, what is needed. Also, when people wear the mask and they wear the glasses, also, I typically recommend that at the top of the mask, one should put a tape. A
Okay.
medical tape can be put half on the skin, half on the mask, so that completely seals the mask to the skin, and there's no air escaping towards your eyes. So
Okay.
it prevents prevents fogging or steaming of the glasses, and also protects the eyes to some extent.
Yeah, and there was yeah, go on, Kim.
Well, just curiosity, you mentioned something more on the left side, or often it's been detected more on the left side. And would it cause pressure to the eyes, or is it just that you notice it more like a disease, like an infection?
It's presenting more like an infection, a conjunctivitis only.
Okay.
There's no increased pressure. There's no effect on the pressure. At least we have not observed any changes in the eye pressure as such. But yes, as conjunctivitis, it is being seen.
I believe there was a study that said that of the people that got COVID-19, less than 6% had glasses. In other words, if you wear glasses, apparently the infection rate was, you were protected about up to 94%.
Well, that's exactly what even I thought so, because I said that there are three portals of entry: the eyes, the nose, and the mouth. You need to protect them.
Right.
So, which would mean that in addition to the mask, we should recommend glasses to people as
Right.
well.
Right. Yeah. And then that was just a recent study that just came out. It was either in Lancet or the New England Journal of Medicine. They were saying, well, if you people that wear glasses, we found out that they're less than 6% of the people that got infected had glasses on, when we know a greater portion of the United States wears glasses. And they said indicates that it does come through the eyes. And even though people are told to wear masks, what they're not being told is to wear mask plus glasses or some, something here to stop the COVID from coming in. And that's just recently that just came out. So I think it's something that the people at IBM TV should be aware of. For me, it's not a problem. I always wear glasses. I'm blind as a bat. But for the other people that are out there, like Ankit, who has 2015 vision, he sees across the world, maybe you have to put some glasses on, some dark glasses on, or something like that.
Nick, as an observation, I've seen so many things in the course of my lifetime, but now I think it's complete. When I was younger, wearing glasses was frowned upon. We were called poor eyes, etc. And now it's not only a fashion statement; it's a medical necessity. So let's chalk one up for the nerve winning. Oh, cool neck.
Yeah, I mean the thing is, what people. I mean, this is just the data that's come in. It's just data that we're looking at. Is that the thing is, glasses are possibly helpful to. It's an empirical analysis to actually reduce the spread of COVID-19. So when you put your face mask on and glasses, what it looks to me, it's a probability. You start reducing the probability of you getting COVID-19. And I think that the face mask with the glasses, they said that the probability is like 1.7% if you have it, and if you have it and someone else also does the same thing, it drops to like less than 1%. If you wear a surgical mask, then it drops down next to nothing. In other words, surgical mask with PPE. Now, Dr. Sanjay, I believe that when you go in to meet with patients, do you have all the PPE equipment on when you meet with patients, Dr. Sanjay?
I'm sorry, I don't do that, because I always emphasize to all my colleagues and everyone that you need to take care of four things. One is, as said, nose, mouth. So have a good quality mask on. So I recommend N95 mask at least. Have glasses on. and use hand sanitizer. And because the moment you wear PPE, there's a false sense of protection. You become careless in handling things. You touch various things and you touch something else. There's a higher risk of spreading infection or getting infection because you have a very false sense of protection. So I don't wear gloves also, but before touching any patient, after touching any patient, I always sanitize my hand with alcohol-based sanitizer. And I have my sleeves rolled up, so I sanitize my hands and my forearms up to the elbows, and have my mask on, which is properly sealed with the tape, and have the glasses on. And this is what I recommend. I also make sure that the patient is wearing a mask, and they also have a tape on the mask, so that when I'm examining the eye, their breath is not touching my hand. So I emphasize on these things more. Whether I'm seeing patients in the my outpatient clinic, even when I'm operating also, I'm not wearing a specialized PPE, but we are testing the patient beforehand for COVID. So
Okay,
sometimes
right.
sometimes the use of extra protection gives you a false sense of security, and you tend to become lax on the more important things.
Right. Okay, but so you're taking precautions. Yes, Kim.
Well, it's not maybe a question, but I want to clarify something because when I was visiting the hospital the other day, they put a mask on me. They put the tape on me like you suggested.
Yes.
And I think that's a very good idea because I don't think it is as sealed as we think it is. It also helps prevent the glasses from fogging. I picked up some other tips, but in caring for our eyes during this time, are there some other things we could do, like maybe certain kind of eye drops to keep them cleansed and rinsed and moisturized? Because we're undergoing some strange transitions, right? Wearing masks, people with their glasses getting fogged up, that steam goes there. But can we do that? Is there something that we can do for our eyes?
So no protection in terms of the COVID other than wearing glasses. However, yes, the eyes go dry. We're spending more time online on the screens. Our eyes getting strained. The muscles are getting weak. So regular eye exercises and use of simple lubricant eye drops is what I'm recommending people. And taking frequent breaks from screen, taking enough rest to your eyes, sleeping well. So all those general precautions are required. So regular eye exercises, use of simple lubricant eye drops, use of glasses is what I recommend. But no specific drops to prevent infection, because there's none.
What about social distancing? We've been practicing staying away from people, which is something I really enjoy doing anyway. So the thing is, but when we walk every day and we see people close by, we move away to make sure that we keep 6 feet at least or more away from somebody. Is that an effective thing to do, or is that difficult to do in India?
It's difficult to do, and whether it is effective or not effective, only time will tell, because we don't really know much about this virus. Our knowledge about this virus is slowly increasing day by day, and as I remember that in the month of March when the thing started, there's no talk about using a mask. The mask came on later on. And so our knowledge our collective knowledge is evolving. So it's better to play on the safer side right now than to err on the unsafe side. So trying to maintain a social distance is a good idea. At least it conveys to the other person that you are taking precaution and the other person needs to take precaution.
Yeah, and it looks like our message is starting to get through. Oh, there's Ankit. Our message of wearing glasses is starting to get through. You notice that he's decided to wear glasses now all of a sudden because it will help him not get infected, and we can't afford to lose him and his 1.3 billion Facebook followers. That would be awful here at IBM TV. So wearing glasses is certainly, I think it's certainly at least is a way to go. In other words, people should look at wearing glasses when they go out in addition to the face mask, because again, it's just probabilities. Try to increase your probability. Now, what about traveling by airplane? I've stopped traveling by plane. I used to fly a lot. Do you think it's safe to fly airplanes right now? I mean, should you get on an airplane right now from COVID-19?
So the number of cases that we hear about people who are traveling and getting infected is so high that I would say it is not really very safe. And if look at it from a different point of view, if there were no air travel, we won't have this pandemic. So one of the reasons for one of the reasons for
That's
this
a good
pandemic,
point.
is the air travel. No,
Yeah.
if there were no air travel, this infection would have been there in Wuhan and would have become over in about 2-3 months' time, and there would not have been any pandemic. So the
Yeah.
air travel is the reason why it has become pandemic, and there is some factor which actually has promoted the infection through the air travel. No? Whether it is the closed environment of the aircraft and the air which circulates across the aircraft inside, the air is very dry, there's a pressure difference or whatever, but somehow those factors are there. So I think one needs to be very, very careful, at least avoid all the non-essential travel. If something is really essential, then one has to do that.
Right. So air travel out. Yes, Ankit.
So, Dr. Dhawan, I just wanted to ask you a little different question in regards to the technology and gadget we are using. Everyone is on their mobile phones and laptops and tablets, and it's a lot of brightness.
Right.
And also, when we talk about the last Apple event, they are talking about 80% more brightness on their mobile devices. How that impacts person's eye? Because I think on an average, like 4 to 5 hours, we spent most of the time just watching those gadgets very closely.
Yeah.
What do
So
you?
the screens affect the eyes in two ways. Number one is, which is the main thing, is that everything which is placed close by, our eyes are focusing at a close distance, and eyes are converging towards close distance. So prolonged near focusing and convergence puts a lot of strain on the eye muscles and focusing muscles. So the muscles get tired, we feel strained, we feel discomfort, there's a blurring of vision, we can even get headaches, brow ache, doubling of vision also. So there are a lot of strain and visual disturbances there due to muscle strain, for which taking frequent breaks, keeping the screen far off, doing eye exercises, and improving the quality of sleep will help. Second, when we look at any screen, our blinking frequency goes down, and as a result of which the tear evaporation is more, so the eyes go more dry. So again, making a conscious effort to blink more frequently and using some simple lubricant eye drops will help. So I would say that to use a larger screen further away from the eye, keep it at a higher level so that your back and neck is straight. Every 10-15 minutes, sit back, close your eyes for a minute. Every hour or so, take a short walking break. Avoid unnecessary screen viewing. Take enough sleep at night. Maintain a good health otherwise. This will go a long way in taking care of your eyes.
Yep.
And also,
And this is
the
more so with the school kids, because all the classes are happening online. So children, the parents need to be very, very careful that the school kids, they take frequent breaks, and they should not be given phone screen or tablet screen to have the classes. They should be larger screen of a laptop, or a computer placed further away from the eye at a higher level so that the posture is maintained. And every 45 minutes when the class finishes, they should be given a compulsory, 5 minutes to keep their eyes shut.
Mm-hmm.
And Dr. Dhawan, also, what's the best way to wash your eyes? I mean, what do you recommend? Because generally, everyone follows some kind of practice, washing the eyes with cold water, hot water, or just like splashing the water on the eyes. So, what is the? What is the way you would like to suggest to our people?
I will emphasize on clean water. Cold or hot is what your preference is. The water should be very, very clean. There should not be any infection in it. Washing them too frequently is not helpful because it washes away the natural ingredients of the tears also. But yes, washing your eyes with the cold, clean water once in the morning, maybe towards the end of the day. So once or twice is not right. Yeah. But not very hands are clean.
Okay. And I think Jongwa is having some questions for Dr. Dhawan.
So Ankit asked me to ask this question I was putting in the chat box. I think, what are Dr. Dhawan's biggest concerns this year and for the next 5 to 10 years? And then I had some other questions about how popular is vision therapy and what does Dr. Dhawan think about it? And also how much of an issue is access to clean water in India?
Okay, so I did not get the first part of the question. For the next 10 years, the concerns regarding what?
So for the next 5 to 10 years, what are your biggest concerns as an administrator of this eye hospital?
Okay. So I think the concern is more for the next 1 to 2 years, because that is the time that I anticipate that this pandemic will take. And I think in about 1 to 2 years' time, there'll be enough for people infected, and there'll be herd immunity, or we'll have a vaccine, and things will be in control. Then it'll become like any other viral infection. So concern is more for this 1 to 2 years to come. In this 1 to 2 years, my other concern is that people are scared to come to the hospital to get eye treatment. So the conditions are getting worse. So, for example, old people with cataract who do not want to step out of the house for the fear of COVID are delaying their cataract surgery. So, when they're presenting to us with the cataract is more advanced and more complicated. So, things are becoming more difficult now. So, poor vision is adding to their problem at home. So this is what I would say, that for next 1 or 2 years, this concern is there. Glaucoma is getting ignored because glaucoma requires regular follow-up. Diabetic retinopathy requires regular follow-up and treatment. So the treatment of those conditions is getting delayed or getting ignored because of the pandemic and because of fear that people have. And most of these conditions involve old people. So my concern is more for next 1 or 2 years, that maybe once the pandemic is over, we maybe get a whole barrage of patients with complicated situations in their eyes, advanced cataracts, bad glaucomas, bad retina conditions, maybe more severe uveitis, and I don't see after 1 or 2 years things will settle down again. So things may be back on track, but this next couple of years we may have to face some difficulties now. And regarding the vision therapy, I guess you mean LASIK laser surgery for
No,
getting.
so there's actually a vision therapy that is controversial in the US. Some of the younger doctors have been using it for quite a while. It was recommended for our son and many other children. And other people think it's quack science. So this is to help address some of the cross-eyedness sometimes that is impeding learning, where you actually look at things such as 3D images to try to train your eyes. I'm kind of curious if this is popular in India and in the schools.
I'm not aware of it. I'm sorry, I'm not aware of
That's okay.
it, so I will not be able to comment on that. No.
That's okay. And so during the pandemic right now, during this crisis of the flare up and the increase in incidences of COVID-19, does that mean that your hospital is pretty quiet because people are afraid to come in until their perception of risks goes down?
During the period of lockdown, we did not see any patients, and then after the lockdown, people were hesitant. But now people are coming up. People are coming, and so they are. So there's a very mixed response right now. Some people don't hesitate coming out. Others hesitate. So it's a mixed thing right now. And but yes, more and more patients are coming up. So we are also increasing our clinic hours as the time is going by. And our surgeries are also increasing slowly.
Okay, so during lockdown, maybe the quarantine is lifting a little bit, so people have more access to your hospital, and they'll realize that it's actually a safer time because you're maybe taking more precautions than at other times. What is the access to clean water?
Well, in Delhi NCR, we have got good access to clean water, but that is not the situation in the remote areas of India. It's a very mixed thing, and clean water is still little. It's a problem, it's not as universally available, and because the government supply or the structured supply of water is limited to big cities, smaller cities, not to the remote peripheral areas, not to the villages, where they still depend more on groundwater or water from the streams and the rivers. And with the rivers getting more and more contaminated, that water is not as potable as it used to be at one point of time. But the government is aware of it, and I think that they're trying their best to address this issue. And clean water is still is an issue.
So, as an eye doctor who's very invested in your field, do you do some kind of outreach to the rural areas, or are you mostly focused in your hospital, of course, because you're so busy? What kind of outreach efforts are there in the ophthalmology field?
So, at presently, I am focused mainly in my hospital only, in the city only. However, in my earlier days, I was part of a hospital which was called the Lions Hospital, which was part of the International Lions Program for Prevention of Blindness. So we had a lot of outreach work which was being done. I have spent some time in Nepal also, so as part of the Nepal National Program for Prevention of Blindness. So I have been in part of those programs, but for last almost a decade, I'm not doing any peripheral, any outreach work. However, there are a lot of hospitals in India and in Delhi who have outreach programs. So what they're doing is they're running clinics in the periphery, screening the patients over there, and bringing the patients to the main hospital and operating on them there. So there's no longer surgeries happening in the outreach and the peripheral camps, but only screening is happening there, and all the patients are being brought to the main hospital and operated upon over there.
That's awesome. And how expensive is access to eye care in India?
There's a government funding for those programs, and those patients are being treated practically free of charge.
Wow.
So yes, it is. It's more of access may be an issue, but expense is not an issue. On the whole, the eye care in India is much more affordable than anywhere else.
That's fabulous. Thank you.
Anana, you have some question for Dr. Sanjay?
Oh, yes. Thank you so much. Hello, Dr. Sanjay. So,
Hello, hi.
as we all know that a lot of young kids are spending too much time on screen these days, and contact lenses are so much famous in them. And we all know that caring for contact lenses in normal days is very difficult. So, how do you suggest to take care of those kids who prefer to use contact lenses in these times?
So I tell them that don't wear lenses when you're working on the screens. And if they're homebound, if they're doing online classes, so there's no real need to wear lenses. I tell them fine. If when you're going out, feel free to wear the lenses, but at home, when you're on the screens, do not wear lenses. But yes, if somebody must wear contact lenses, then hand hygiene, cleaning of the lens, cleaning of the lens case is extremely important. So each time you touch your lens, your hand should be very, very clean. You must take care of the cleanliness of the lens also, the case, the cap. So those precautions need to be taken. You may have to use lubricant drops more frequently because the eyes go more dry with the lenses. The strain on the eyes more when you're working with the contact lenses on. So the eye strain of screen time is much more. And since you're not wearing glasses, so the tear evaporation is more, drying is more. So the discomfort and dryness is more with the contact lenses on when you work with them on the screen. So I personally recommend that not just kids, but also adults who, if you're sitting at home working from home, should avoid using lenses when working on the screens. When they're going out, please feel free to wear your lenses, but at home and on the screens, avoid that.
Thank you so much.
Come.
That's an amazing discussion with Dr. Sanjay, and we learned a lot of things about how to protect eyes and what are the ways and different studies which we are doing to research. But Dr. Sanjay, I mean, when we talk about ours, we are still, because a lot of my family members also are suffering from some kind of an eye disease, and a lot of diseases are still in research, and they're not sure whether it's in research or it will come out soon or what's going to happen with that. So, do you think are we covered with the research of eyes in terms of complete damage and we can change the eyes, or we are still working that part out? Because a lot of people lost their vision slowly and steadily, and then it's difficult for them to get that vision back.
So talking about ophthalmology and the whole, ophthalmology has advanced to a great extent, but I would say there's a lot more which needs to be done, and that is true for every part of the body, the whole body itself. And we cannot change the eyeball as such. When we say, when we talk in terms of eye transplant, we basically mean cornea transplant. Cornea is the clear black portion of the front of the eye. So just this 10 millimeter of cornea, this is the only thing which can be transplanted, which means that if somebody has got problem in the cornea only, then the cornea transplant can help. But any other part of the eye cannot be transplanted. There is a research going on, something called bionic eye, that there is an artificial retina which is being developed, which would connect to the brain with the electrodes. But that's at a very, very rudimentary level. And that is also meant for people who are totally blind, have got no vision, and they will get some, again, very primitive, rudimentary vision, which would not be a formed vision. So, as far as the retina is concerned, the optic nerve is concerned, we are still at loss. There is not much hope in future. However, things like cataract surgery, refractive surgery, squint surgery, other retina surgeries have developed to a great extent. Orbital surgeries have become much better. The malignancies of the eye and around the eye have got much better treatment available now. But advanced retina diseases and optic nerve diseases, still we do not have much to offer for those things now.
And also, Dr. Dhawan, there are a lot of patients with diabetic and they have low eye vision because of high pressure. So, what kind of treatment you have for those patients?
So, diabetes is predominantly a disease of small blood vessels, and it very slowly and very silently damages small blood vessels all over the body, be it brain, be it eyes, be it heart, be it kidneys, be it the nerves. However, in the eyes, that is the only place where those small vessels can be seen at a very early stage. So, screening of the eyes, examination of the retina of the eye is a very important tool in detecting early changes in the blood vessels. And they show up in the eye in the form of what is called diabetic retinopathy. That is the affection of retina by the diabetes. And so when a person gets diabetic retinopathy, the diabetologists are also alerted towards the possibility of kidney involvement, brain involvement, heart involvement, and nerve involvement also, because the blood vessels are the same everywhere. And we follow up these patients regularly. If the changes progress, then we intervene. And intervention is mostly in the form of preventive lasers for that. So what is called the photoreflective preventive photocoagulation for the retina. In cases there's a leakage of fluid in the retina, or there's a leakage of blood, then some special injections are given in the eye. So the treatment is more of a preventive treatment and not really curative treatment. But yes, it also helps as an indicator for the possibility of involvement of other organs. So retina examination is a very integral part of diabetes screening. All people who got diabetes, they must undergo retina examination once in a year if everything is fine. But the moment any changes start in the retina, then more frequent examination is required. These changes are more common in people who got what is called juvenile onset diabetes or diabetes type 1, because the diabetes starts much earlier on and changes progress much faster. And they're little less common in type 2 or the old age diabetes. But both can be affected, and we can only prevent severe form of retinopathy.
Okay, that's wonderful, sir. So, do you think that people who are suffering from diabetes, they can prevent it, but it's not fully curable, but they have to maintain and go for regular testing and regular eye check and all those stuff, and maintain their health and wealth in terms of
Yes,
eye
yeah.
care.
So it's very important for them to have a good diabetes control, because if the diabetes control is good, then these changes come up very slowly and progress very gradually. In the progression of these changes, this comes a very small, very narrow time window where the intervention is required, and we don't want to miss the time window. That is the reason why regular examination of the retina is needed now. Because sooner than the time window, it is not really, there's no intervention needed. If you miss the time window, then maybe a little too late for the intervention to take place.
And Kim, you want to discuss about your... Yes, Kim. Yes. You need to unmute, Kim. Unmute yourself.
There you go.
My computer's been making weird noises, so I'm muted. But I have some questions. But I wanted to ask too, with all of this glare that we're doing, would it be wise to get a special anti-glare glasses for our children and for ourselves, even if we don't need glasses to see with? Would it be good to find an anti-glare?
Anti-glare glasses don't really work much other than preventing dryness of the eyes, because the anti-glare coating does not cut out the glare that is coming from the screen of the computer. It only minimizes the glare which is produced in the glasses itself. So it's a misnomer. Anti-glare is not for the glare outside, but the glare from the glasses itself. Recently, there is some talk about blue light filter in the glasses. Some studies have shown that prolonged exposure to blue light may be harmful for the retina, may affect your sleep adversely. So they are recommending blue light filter to be there in the glasses. Again, it's a very, very early studies. There's no short thing. But yes, if somebody wants to be extra cautious, then having a blue light filter in the glasses may be advisable.
Thank you so much. And I think we're at the top of the hour for intros. And I do have a question for you. I think Ankit was excited about me meeting with you today because of something. But I am one of the founders of IBM TV, and we thank all of you for watching us. To my right or left here, I never get those right, but is Ankit all the way from India, who is one of our producers. Also from the Tower Power, our White House correspondent, and of course, American Politics TV show, Bill. And then we have Junhua, all the way from San Francisco. Am I correct? Yes. And she is a spiritual person who teaches his peace. It's going to be hopefully starting a show soon. And then we, of course, have our modern investing from Sasha in Canada, although he is also from Russia, and he brings us a world and wealth of information. But he also has chess stars, which I've been told that playing chess is actually good for eye and hand coordination. Then we have Dr. Sanjay from India, who is an ophthalmologist who's teaching us about good eye care and some of the precautions we can be taking during this COVID period. But anytime, these are good precautions anytime. And then we have Dr. Ramesh. Hi. And so it's great to see everyone. I do want to share something with you while I have you here. Since COVID, go ahead, Ankit.
I just have a question for Dr. Sanjay. I mean, before I forget, because Dr. Sanjay, a lot of, at institutes and hospitals and everywhere, we are checking that laser thermometer for the temperature. And generally, right. The staff, they're checking it either the forehead, and then when we try to check it, it always passes from the eye because a lot of people don't wear glasses. How is that impact on the eye and especially in the forehead while checking those thermometer scans?
So I think now they're checking from the hand, They're not checking from the forehead, they're checking from the hand or the arm, And in any case, the radiation is so minimal that probably would not affect the eye, It's more of an infrared ray. It's not really laser. It's an infrared light which it emits, and so that is harmless.
Okay.
That's good to know. And I did hear that they are starting to test the hand or the arm, which is interesting that we've learned that this works. One of the things I wanted to share with you since COVID had started, I have always had like dyslexia and things like that, but taken very good care of my eyes. And they've always seemed to function great for me, other than I had to have some training many years ago. But since COVID started, I started getting a huge pressure behind my left eye, and it just wouldn't go away. And it started going into my sinuses and in my throat, and it just stayed on the left side. And then over a period of time, and almost 6 months, it finally feels like it's spreading, and the pressure just keeps getting bigger and bigger. And by evening, I literally cannot read anymore. Like, even with glasses, my eyes are shot. And I've tried to reduce this, even though we do this several hours a day. But they've done brain scans to make sure that the pressure isn't from any infections. They've done tests on my eyes. They just don't seem to see what's going on. I know it's real. I know that they think that maybe it's not. When they're testing me, it's daytime. So, of course, my eyes are going to be okay. But it's at nighttime I'm starting to lose that visual. It almost feels like it's going into a tunnel vision and very, very blurry. Do you know of anything like this? And again, it started on the left side, and it's still there. The pressure is still there all the time.
Yes, so this is exactly what is happening to almost every other person now, and it happens typically because of long hours on the screen. Okay. The 100% sure shot remedy cure is stop looking at the screens, which is not possible. And so the next best thing would be that you take a lot of precautions, which means really a lot of precautions. So every 10 minutes, religiously sit back, close your eyes for 1 minute at least. every hour or so, take at least 5 to 10 minutes break, Do regular eye exercises twice a day. Increase your sleeping hours. Whatever is the non-essential screen time, just cut it down. Blink more frequently. Put lubricant drops in your eyes more frequently. If you're gazing at the screen and stuck at some problem, just look away. Don't keep gazing at the screen too much. No. So like for example, if you're having a meeting and somebody's talking, you can look elsewhere and listen to the person. So idea is to give your eyes sufficient rest. Our eyes were not designed by nature to look at the screens, to look at even near things. We were all supposed to be animals out in the jungles, out in the nature. We were supposed to spot our food from far off. So look at far off most of the time by running around and look at the near thing only while eating. So which means 95% of the time we should be looking at far off things and 5% of the near thing. But now what has happened is it is the other way around. 95% of the time we are looking at the near things, maybe 5% at far off things, that too on television or while driving. So 100% of the time our eyes are strained and they're stressed out. And that's the reason why we're experiencing all these difficulties and problems. So you need to take break from the screens. You need to rest your eyes. You need to sleep more. You need to maybe go exposed to sun. So physical workout, sun exposure, all that is required. And I can understand you must have gone through all the investigations. And before you said the result, I knew that you were going to say that MRI scan was all normal. Everything is all normal.
It's all normal.
Yeah. So it's I give a very typical example. I say that okay, try standing on both your feet for 8 hours in a day.
Oh, wow.
What will happen to your legs at the end of the day?
They swell.
You cannot do that more than an hour or two. But we do this to our eyes day in, day out. 4 to 8 hours every day we are focused on a screen close by. And so we are actually actually abusing our eyes. So you have the answer. Now you know the cause. So you have the answer that what you should do to take care of that.
Right. And you know what is interesting is at first I didn't think anything in my life changed because it was nothing for me to be on set for a whole day, but we weren't staring at a screen. We had a camera far away, and we had each other, right? We would be talking just like we would face to face. But you're right. My whole life changed on March 7th doing this. So yeah, I am definitely going to start making those disciplines. Thank you.
Thank you.
Thank you. Absolutely.
I think Sasha wants to take a break. Before Sasha takes a break, we need some comment from Sasha about eye care. Sasha?
I have to take time off my screen just to save my eyesight. Have a good show. Bye-bye.
Thank you.
Bye, Sasha.
Dr. Dhawan, Dr. Dhawan, we have Dr. Ramesh Varia joining us from Kerala, and he's an Ayurveda specialist. Before talking to Dr. Ramesh, I would like to know, you are also following the Kada recipe during the pandemic?
I'm afraid I'm not. I'm not following any recipe. As I said, that I'm just thinking of these few things, that mask, glasses, and hand sanitation. That is what I'm focusing on. And yes, I maintain a good health otherwise. So I say that it's not the immunity that is important now. Your body should be fit otherwise. You cannot build immunity in a day or in a week's time. So immunity builds up only when you have been taking care of your body on a regular basis. It takes weeks and months to build up the immunity. So it's not that, if today you are to drink a kada, tomorrow you'll be fit. No, it's not. That's not how it happens. You have to be careful. Your lifestyle should be such that you're more careful about these things.
Yeah. Very well said. Dr. Ramesh?
Yeah. Good evening. Yeah. So I was telling about the diabetes, diabetic retinopathy and such complications.
Yeah.
Of course, Ayurveda also discusses very much about these complications. So definitely prevention, because you may also be agreeing with that. Prevention is always better than cure. So in diabetes, generally, I advise 4 things, because being a general physician, not a specialist of eye and all, but a general physician,
I advise four things because, like the four legs of a stool, one is diet control, second is exercise, third is stress control, and fourth only comes relief. So, if you are doing all other aspects, definitely then a total, prevention of diabetes or complications can be to a certain level we can do. And if you do only one thing, if you are on medicines, if you are on diet, if you are on regular exercise, but if your stress is not under control, because some people will be having that because they will be having that kind of stressful job, their sugar level always goes up and the HbA1c always will be on the higher side, and that can lead to these kind of complications. So always prevention is better than cure in diabetes, and the lifestyle modifications are very, very important. And nowadays, I would, Dr. Saib will be agreeing with me, the new researches, the microbiota in human body is something that is contributing a lot, because now what they say that actually the new researchers say that the microbiota is transmitted from our ancestral people. That means more than DNA, the microbiota is actually giving you the hereditary factors. So microbiota is nothing but so many bacteria, viruses, and parasites which are living inside our body. And so this aspect also may have to be considered now when you think about all kinds of disease, lifestyle disorders, especially diabetes and all. So this is a humble suggestion that I would like to make in this venture. So then, of course, Ayurvedic medicines, Ayurveda mainly depend, Kerala tradition mainly depend upon herbal preparations, mostly herbal preparations. So herbal preparations make a lot of, because when I was in Delhi for 18 years, we had a research collaboration with CSIR and all. And in that, what we have observed is that actually the Avala means gooseberry, and haldi is turmeric, and Iloy is Tinophora cordifolia. That combination, if you were using in diabetic conditions, early diabetic conditions, the complications found to be less because it contained a lot of antioxidants, and the damages to the nerves and such things were found to be preventive. It's a kind of preventive aspect contained. So definitely, what I was trying to say, because I had an opportunity to work with modern medicine people in the area of cancer and other arthritis and all. So what we have observed is that a judicious combination of these two systems, judiciously, it has to be done in a judicious way, that actually helps to improve the quality of life of patients. So in the case of I would like to tell you, sir will be interested to know that my nephew is actually a physician, a doctor in US. He is in Michigan now. He had a bad eye infection with his contact lens, and there was a corneal opacity, which they managed very well, giving high dose of antibiotics and all. But the corneal opacity occurred, and they said that now the corneal transplant is the only remedy which modern medicine can. So he came here to India, and we did, because there are Ayurveda specialists who treat eye disease. So here we did one of the herbal preparations, putting in the eyes and all, and the 2/3 by the end of the day, 28 days treatment it was taken. By the end of the 28th day, 2/3 of the corneal opacity was improved. And this was actually in US, they were studying more about this thing. How did you do this? Because only corneal transplant was. So what I was trying to convey is that with an open mind, sit together and do something in these kind of complications that makes a lot of difference in the improvement of complicated cases. So just a suggestion. Yeah.
So I have a few comments to make on this now.
Yeah.
Regarding the microbiome, which Dr. Ramesh talked about, this is a very interesting old tradition in India. When a child is born, after a few days, a mother will feed something, she will eat something, chew it, and the chewed thing is put in the child's mouth.
Yeah.
This is a tradition. Now, if you look at it scientifically, what she's trying to do is she's trying to inoculate her own microbes into the mouth, into the gut of the child.
Yeah.
And why is it done? Because the microbes that the mother is carrying, she also has the immunity to that, and that is the immunity which has gone across the placenta to the child also. So these are safe microbes, which when they proliferate in a child's gut, will be good for child's health. This is an age-old tradition. We never knew anything scientific about this, but that's a fact. To the second point about diabetes is a lifestyle disorder, and we need to alter our lifestyle. And my ideas may find a bit radical. I say that we can learn a lot from the animals. Most animals, when they live in the wild, they don't get diabetes because their lifestyle is such. So though we can't go back to that lifestyle anymore, but we should try to emulate or mimic that style as much as possible. Human body is an amazing machine, and nature has given so many resources which we are not aware of. We should not dismiss them as just because we don't have any scientific proof for them. So we should always be open to those ideas. We should be open to those things. Regarding the cornea opacity, which Dr. Ramesh said, yes. Cornea can undergo modulation, remodeling, and I have myself seen opacities disappearing over a period of time, sometimes with treatment, sometimes without any treatment also. So nature is actually amazing, and we should always try to learn from nature, and the best way is to go to those species where the civilization and modernization has not touched. So I would say that if we learn a lot from the jungles, from the forests, from the animals, and if we try to apply it in our own life, we'll be benefiting. I'll give you one very big example. Animals do not get back pain. They do not get disc problems. They do not get disc prolapse. The reason is that because we were not designed to be standing or sitting upright. Ever since the human beings got into 2 feet, they work against it. So the moment we work against the natural design, we are bound to land up in trouble. So we should, if we have a trouble, we should try to work backwards. That what was the natural design, what was the nature, what were we supposed to do naturally, and try to follow that as far as possible. I mean, it's not much is possible these days because we are so far departed from the nature. But what is possible, we should. So we should look for remedies, and we should look for solutions in nature for that.
That's wonderful. Dr. Ramesh, I need to unmute yourself. Yeah.
Yeah, that is. Are you hearing me now?
Yes. Now it's fine.
No, just adding to what Dr. Saab was telling, Ayurveda gives a very beautiful theory of how ailments are happening. Because they simply say that Hina Mithya Adi Yoga. It's a Sanskrit terminology. Hina Yogam is any organ. If you take the sense organs, if it is Hina Yoga, because eyes are for seeing, just like you are telling. But if you are not using your eyes at all, that is a kind of Hina Yoga. We are not underutilizing our capabilities. So it can affect your eye. If you don't walk, you won't be able to walk after some time. And Adiyogam is the excessive use, which Dr. Saab was telling about. Excessive usage of your eyes because it is not supposed to be used in that way. But we are excessively using. Back pain, same thing. We are sitting 18 hours a day in front of computers, so which is not supposed to be the for our body. So we are doing these kind of things. And mithya yogam is, you are not supposed to do in that way, but you are doing that because seeing the sun, seeing very flickering kind of objects, this is mithya yoga and misuse or abuse. But these are the three aspects which leads to many kinds of diseases. This is an interesting observation I just added to what Dr. Saad was telling. Yeah. Hina mithya diyo. And then, of course, the Kala Artha Karma. That is another theory. Kala means our age and season. Artham, Indriya Artham, which I just explained. And Karma. Karma means what we do. Because if you are walk, overdoing. So these are the three areas we need to be careful about to maintain our life. So this is a advice from Ayurveda. I just wanted to discuss.
Wonderful. I think what we understand is that excess of everything is harmful, be it watching more television or be it more time, or be it more exercise or be it more having more water, because we need to balance our life in a way that we can manage a lot of stuff, and then only we can make
they should have a balance. We should have a balance. Yeah. In the case of emotions also, Ayurveda always discusses that and of course, another very, very interesting theory in the modern era is that actually, I don't know, the modern generations will agree to that. What they say, the natural urges, you see our sneezing, our laughing, our defecation, our urination, these are all natural urges. Which these natural urges, either you inhibit or you forcefully excite. And if that becomes a part of your life, that means you are in a meeting, you have to attend so many meetings a day. So you have to control your urine, control your other aspects, and then you forcefully do that whenever it is not needed. This actually, if it becomes a part of your life, 1 day, 2 days, not if it becomes a modern busy man in our lifestyle, we have all these things. So at that time, the internal environmental changes happens, and some long-term chronic conditions can happen along. And in Charaka Samhita, which is the literature, classical literature of Ayurveda, in those days, because you should understand that it is written 3,500 years back, Charaka Samhita, at that time, they were giving examples, king soldiers, priests. So priests cannot do, so they are sitting continuously long hours and king soldiers also, they have the duty, so they will have, they are called Sada Atura. Sada Atura means they will be having some kind of problems internally because of the internal environment is altered very, very, very frequently. This is another knowledge from Ayurveda. I just wanted to share it.
I think it's very great knowledge. And I think that these are things that we just need to continue to expand on and understand for a better, healthier quality of life, right? Because at the end of the day, there are some things that we end up doing to our health if we don't maintain our immunity that we could destroy for life. And so it's better just to go ahead and continue not just putting these practices in place for ourselves, but for our children, right? And inspiring these healthier lifestyles. And I think that there's more that we can do just in talking about our eyes and how important they are to us. We're talking behind stage here, doing daily exercises, rest therapy. I've kind of in an interesting way, eye yoga. Why can't we come up with an eye fitness program that people do on a daily basis, even if it's we just remind them, take 5 minutes and do this exercise. And then maybe next week, so it doesn't get boring, because let me tell you, I did eye therapy for a while and it can get boring, is find a different thing for them to do every week, to just pause for a minute, like you mentioned, blink a few times through the hour. Now I'm going to try to do that, but I have to be very careful, because one time I was complaining about an abductor or something, and someone told me, if you just blink 4 times, I'll go take care of them. And I'm like, oh gosh, I don't blink all day now. So, no, I'm just joking now, but blinking more often, doing maybe some eye drops throughout the day, but just, you had also mentioned just staying physically fit is also good for our eyes, right? Because we want to keep those arteries open and the blood flowing and everything. But I think that all of these healthy alternatives, just adding these things to our life is just going to improve us some. Bill, do you have something to say?
No, actually, I'm just learning a great deal. And so, sometimes, well, no, wait. Sometimes when you are in the presence of excellence, the best thing to do is just listen.
I know.
Listen.
I know, and I hate not asking questions, but I get into that mode of because I know asking questions and engagement is the best way to learn. But I'll just be in total awe of, wow, this is just fabulous information that I'm feeling better already, because it's been concerning to me. This pressure has been building up. So I'm already I think just knowing some of these things, it's making me feel better. So I appreciate all of this information.
Okay.
Thank you very much. Thank you.
We have a question for Dr. Sanjay from Nigeria. One of our viewers would like to know that, what kind of fruits and vegetables they should take to protect their eyes or make their eyes healthy, or maybe some kind of, benefit if they have cucumber or maybe something else, because they just wanted to know that, what kind of diet is good for eye care? Dr. Sanjay?
So I would say that I'll give a very, very unromantic answer to that. A healthy, balanced diet is what is required. They should not, excess of anything will not really help. You don't need to eat too much of anything. If you have a good, healthy, balanced diet, if you have a good, healthy lifestyle, it's good for the eyes. There should not be shortage of anything. There should not be any deficiency of anything, but too much of the same thing will not really help. So there should not be any deficiency of vitamin A, but eating too many carrots, too much of fish liver oil will not really be of any great use. What is more important is, yes, taking times off from the screen, giving eyes enough rest, exercising, sun exposure, sleeping well, and maintaining a good health on the whole.
I like that you said that. You said sleeping well, not just sleeping more, but there is a difference about sleeping well. That when you sleep, that you're actually sleeping.
Yeah.
That there's a huge difference. Lots of water. I keep, I'm having to remind myself, hydration is probably one of the most important things. And a lot of people don't like water, but I literally, after one of our doctor shows, which was very entertaining, about learning that seltzer water is not healthy for you. Family has one of those. I don't drink it because I just don't like the taste of it. But they actually bought a machine because they just don't like the taste of plain water, which I don't understand why. Because we have wonderful well water out here that just tastes amazing. Yeah. And but they were seltzering their water, and then I learned that that's not very healthy. So, but a good balance. I have a tendency of liking ice cream, maybe a little too much. And so I've tried to cut it back during COVID. I don't think ice cream's unhealthy for you, but I think too much of it, like you said, too much. I like carrots and all the salad foods. Is there anything in particular? Like I used to hear that berries were good for your eyes, elderberries and things like that. Is there anything to that, a myth?
I would say that, just eat a balanced diet, eat more natural food. So the more natural the food it is, the better it is for your eyes, for your whole body. And so as some of the naturists would say that eat raw food, uncooked food, eat natural, eat less, So that's what is important. And again, I would say that, go back to the nature, learn from the animals, And yes, I missed the point in water. Water intake, hydration is extremely important, And I'm once again emphasizing on the need for sun exposure. Sunlight is very, very important for us. But an hour of sun exposure every day is really helpful for us. So we were supposed to be living outdoors. We were supposed to be living in the sun. We were supposed to be living in the nature, and which we are not doing. So we should do that. Studies from US have shown that exercise done indoors versus the same exercise done outdoors, the benefits are much more. Because there are a lot of elements in the natural air, in the natural environment, which we are not aware of, which are good for us. So a natural diet, a natural lifestyle, a balanced diet is what is helpful.
Well,
I like that. I like that.
Now, I have a different question. It's a slight pivot, if I may. If not, I'm concerned about. Well, various governments have come out with plans to roll out the vaccinations. And doctors, while I have you here, how is it that your hospitals are planning on the administration of the various vaccines, given that it might be complicated? You have a high number of people.
Okay, so so far we don't have a vaccine. That is one. And then when the vaccine will come out, it will depend what kind of vaccine is it. Is this going to be a specific vaccine targeted at the genetic material of the virus, or is it going to be a non-specific vaccine targeted at the spike proteins? A spike protein vaccine probably will not be as effective as a specific vaccine. And also whether the virus will mutate or will not mutate. So there are a lot of factors which will come into play, and whether it's going to be a live an deactivated vaccine or a not deactivated vaccine.
Okay.
But yes, having said that, suppose a good effective vaccine does come up and not in a very, very large number, then we need to probably prioritize. We need to vaccinate those people who are at high risk of severe disease from COVID. So the frontline healthcare workers may be given that vaccination first, and older people may be given the vaccination first, So we need to prioritize in that case. And but as far as the distribution is concerned, we have a good system in place in India because of the experience that we had with the polio vaccine. So we know how to reach out, how to make the machinery work, And it's only a question of what will be the type of vaccine, what will be the number available to us, and then how do we need to prioritize that.
Dr. Ramesh? Yeah. Oh, can't hear you. You're mute. There you go.
Pardon? Ayurveda does not discuss about injections or vaccines, but they are actually discussing about the immunity, because which in our earlier shows I have told about that. They are always recommending that you should take care of your immunity. Immunity, same way, like Dr. Saab was telling, you cannot make taking medicine, you cannot improve your immunity. You should have a good air, good water, dynamic metabolism, regular exercises, and good sleep, and a tension-free mind, and a balanced lifestyle. This is what is actually helping to improve the immunity. And Ayurveda specifically discusses about how, because see, we are not boosting up the immunity, because they are discussing only about immunomodulation. The body's wisdom, whatever they are suggesting, the body has a wisdom. Body adjusts it accordingly. That is the theory in Ayurveda. Basically, if the immune system has to be boosted up in autoimmune, this thing, they do that, or it has to be, but there is no theory of immunosuppression like in modern medicine, because we give immunosuppressants to suppress the immunity as it is not, responding to the level of our expectations. But that is not. Ayurveda discusses always about keep up your immunity always into. And for each and every treatment to be effective also, Ayurveda recommends that you should have a vibrant immune system. So this is the basic approach of Ayurveda.
Okay.
Yeah.
So to add a comment on that, if you say look at the spectrum of disease that we have right now, vast majority of people have a very mild disease which is not fatal. A small fraction of people have got a severe disease, and out of which a very small fraction actually becomes fatal. No. So the question is that why is it that a vast majority of people do not get a very severe disease? It's because of the immunity that they have in their body. And this is the non-specific general immunity. So younger people, definitely their immunity is stronger than the older people. So the young age, it is not the age, it is immunity which is working against in their favor. So all the measures about immune boosting, which Dr. Ramesh said, are basically targeted at improving a generalized, non-specific defense mechanism of the body. So there are, see, the tonsils in the throat, the adenoids in the nose. They are the first line immune defense mechanism. They're the frontline workers for us for defending ourselves. So if our immunity is strong, then there is a likelihood that even if the virus enters these areas, it may be checked before it actually enters the blood. The specific immunity comes into play much later when the virus is actually gone inside the body and it's blood-borne. That is where the role of T cell immunity or the B cell immunity comes into play. And there, of course, the vaccine will come into play afterwards. Also, nature gives right to a lot of what is called cross immunity. There are plant products, there are alkaloids in the plant, and again, it's based on scientific, allopathic, natural, the modern system medicine, that the alkaloids seen naturally in the plants are known to boost immunity, which may have a cross effect on various other organisms. So maybe against bacteria or viruses also. So that's why it is important that for us to live a natural life, we be more exposed to the nature. Like you see the hygiene hypothesis, the children who are very well protected, never exposed to dirt, never exposed to outside environment, they're more prone to infection compared to the children who go and play in the mud, who are outdoors, who are playing every day, who are exposed to dirt, who really go dirty and mucky. They have got better immunity. They're less prone to infection. So this non-specific immunity also has a huge role to play in prevention and cure of this disease. Vaccine, I think, will play a very small role for those individuals who cannot have this immunity in them. So more for the older people.
Wow.
That's wonderful. And Dr. Sanjay, I mean, do you think because now we are, we are seeing that there are a lot of disinfection cases going around during the COVID thing, because people who had COVID in a couple of months back, now they have some kind of symptoms. We got reports from Bangalore, from Hong Kong, and from different places. Do you have any idea?
I'm sorry, the sound is a little croppy. I can't understand. Can you come again, please?
I said I would like to know about the disinfection cases which is going around during the COVID thing. People have getting the COVID again.
Try again.
Can you hear me now? Can you hear me?
The network is bad, I believe. And now it's better, yes.
Okay.
Ankit beamed out to reset his system. We have this, technology. There he comes. So.
Okay. Ankit,
are you back?
Nope. So, okay. I guess I have a question now, and to go back to the vaccines, there are apparently two known strands. There's what they're calling the Asian or the Chinese strand, and then the European strand. Now, we've also heard reports about the mutations of each of those strands individually. Can you talk to us? I mean, are those the only two, or do you know of more, or the mutations? Anything you can help us understand, because it's kind of confusing.
I think there are probably three strains going around. One was the Chinese strain, and one is the European strain, and probably India got the Chinese strain, which seems to have mutated again. So probably the Chinese strain has undergone mutation, and what we have maybe now are 3 strains now. But again, these are all conjectures. We can't really comment definitely at the moment.
Okay.
However, so there are possibly 3 strains which are going around, and the European strain was supposedly more severe strain. And what we have in India right now, the Chinese and the mutated strain is much milder strain. Maybe that is also a reason why the mortality is lesser in India.
Okay, and so and that leads me to my next question, which is earlier when you think of the types of vaccines. One, you said that some of the vaccines, because we don't know yet, target the spikes on the virus itself, which are the spikes that attach and then allow the virus to infiltrate our system. Now, would the vaccines that just attack the spikes, would that vaccine be effective amongst all 3 strains and mutations because it's only focused on the spikes, or do the mutations occur on the spikes as well when you have a mutated strand?
So I am not really sure of this, but my logical guess would be that yes, a mutation happening in the genome can potentially affect the spike proteins also, because spike is a manifestation of the genetic material inside. No? And the vaccine against the spike probably will not work very, very well. No? And it is the specific vaccine against the genetic material, against the RNA strands, which will be more effective.
Okay, and so that leads to this question, because I'm really having a hard time wrapping my head around it. Me is that in order to be vaccinated, you would have to get the vaccination for all 3 strands if you are traveling internationally, because if some of your interactions are with people from Europe, you would be exposed to that virus strand. If some of them are from Asian countries, you would be exposed to that. And if some of your interactions are with people from the continent of India, you would be. So would you need all 3 vaccinations for each of the strands?
Okay, so to that again, it's again a logical guess. So it depends. What is this vaccine working against? So these three strains have got something which is different in all of them, but there's also something which is common in all of them. Suppose we get a vaccine which is working against the common part and is effective, then maybe one vaccine will work against all these strains. But suppose if we have a vaccine which is working against only the differential part, then we'll probably need 3 different type of vaccines. So again, it's all very conjectural right now, but there is a potential of having different types of vaccines, whether it should be a strain-specific vaccine or one vaccine will work against more than one strain.
Okay. And I'd like to, Dr. Sagu.
Yeah.
Welcome.
Yes, please. Yeah. Thank you.
Okay.
Thank you. I'm good.
Mark, welcome, Mark. Both of you being in at the same time.
Dr. Sagu, 3 strands, 3 potential vaccinations in order to be complete with 2 boosters possibly each. What thoughts do you have?
Yes, well, if we talk about the vaccine against the virus, then definitely we need to see the basic principle of the vaccine.
Okay.
So vaccine may contain a spike protein. The basic the vaccine may contain the cytoplasmic protein. The vaccine may contain a nucleoprotein, or vaccine may contain RNA or DNA, right? So when we talk about the different strains of the virus, then the different strains have only different type of RNA, because the mutation can only happen in RNA because there may be some change in the genetic sequencing of that RNA, right? But there cannot be change in the genetic sequencing of the spike protein or the other proteins. So if your vaccine is based only on the spike protein, doesn't matter which strain is working, this will work against all type of COVID-19 viruses. If your vaccine is based on RNA, a particular RNA, then definitely this vaccine would be working against that particular strain. So we need to try to make the vaccine which has to be based on, at least if they are working against the spike protein, or if they are working against the entry of the virus into the epithelial cells. So if the vaccine is not particularly for some sort of strains or the RNA, then definitely we need to give the different vaccines. If your vaccine can work against the entry of the virus, then I think the same vaccine would be effective against all three strains.
Okay, and that leads me to this question for all three of you doctors, and that is this: we've heard generally in the public of the various reports of the different companies that are pursuing a vaccine or a version of a vaccine. Do we even know whether which company is attacking the problem of the spike versus which companies are attacking the problem of the RNA sequencing? Do we know any of that amongst all these trials?
Yes, we have a list which is available. We have a list which is available, and that list says particular part of that vaccine, what vaccine is working against which part of the virus. So we have a complete list, and when the vaccine would be out, then they will give a complete catalog containing each and every detail of that vaccine, whether the vaccine is against mRNA or it's RNA or it's a protein or the spike protein or a complete it's an inactive virus, because some vaccines they're containing the complete virus that is an active virus.
Okay, and so then that leads me to this question, because there has been a great deal of chatter, particularly driven by the American election process, and that is this: that you have Trump claiming that a vaccine can be ready or will be ready sometime, possibly in 2 weeks. Others have claimed that we have to wait until July of 2021, and even a third school of thought has indicated that maybe there might be a vaccine available in December of this year or January of next. How do we evaluate those claims, given where the test trials are now and what you know of how they are approaching the vaccines with the various studies? I mean, how does one like myself even begin to figure out what statement is true?
Dr. Sanjay? Dr. Sabir backstage, Dr. Dhawan?
Yes. So maybe I think I would say that prospectively there is no way to make it out. Retrospectively, I think we'll be all very wise, But so right now, your guess is as good as my guess,
So then everybody's just making it up.
Yes.
They're just making it up as we go. Okay.
Yeah.
So Bill, I think Dr. Sanjay wants to say that red and blue, they both are in balanced situation. It's just a matter of timing, and then we'll get to know who is winning.
Also, that making a vaccine is one thing, and then when trying it out in a real life situation and then seeing the results is a different thing. Sometimes a vaccine may work very, very well in a lab condition, probably may not perform as well in the real life condition, and vice versa. So time will tell that which vaccine will work more effectively. So we have to wait and watch for that.
And so, Dr. Sagu, so we have no time frame then on a vaccine, despite what everybody else is already saying. Is that right?
Yes, we don't have a time frame for that, definitely. But as Dr. Dhawan said, rightly said, that we need to see the effectivity of the vaccine plus safety of the vaccine. So that can be evaluated only through the trials, which are there are some vaccines they have gone through phase 1 and phase 2 trials, and they are about to enter into the phase 3 trials. So these trials they include their the animal trials, and then there's the human trials. In the human trials, first they do the domestic human trials, and then they do the international human trials. So the University of Oxford, along with the Serum Institute of India, they are working on the vaccine. That vaccine has already entered into the phase 3 trials, and the trial in India is now about to happen. So because of something happens in UK, so that's why they have been halted for some time. But definitely they are going to be there. And these types of trials, even I would say that we should be doing all these trials in different category of the people. So we have seen that obesity has come up with the individual risk factor for the COVID-19.
Yes.
So I would say that when we are going for the trial for the vaccine, are those trials which are equally they are effective on the other human beings? Are they equally effective on the obese people also? So that is why these trials has to be done on the different category of the human beings also. That may include obese, that may include the elderly, that may include with the comorbid conditions. So actually, we need to see the effectivity on each and every individual. Along with, we need to see the safety on each and every individual.
Okay, so let's ask Sharif. You have to unmute your mic, and then Mark, I'm going to come to you. So, hearing that at least publicly, we have all these officials saying that we could have a vaccine anywhere between next week and next year, and hearing Dr. Sagu and Dr. Sanjay explain it, how are you reacting then to this idea of when we might get a vaccine? Sharif?
No, as a individual people,
Yes, we can.
Can you hear me?
Yeah.
Yes. As an individual people, my major objective is that I want to see that this vaccine is definitely maintaining the safety and security for human body, because we never know. Like example, this is the first time they are producing this type of vaccine, and what is the reactions and the outcome from these trials. I'm very interested, because maybe there are doctors, they know better than me because they are very professional. But definitely we have to focus that what is the trial result, as well as how they can maintain the safety and security of the human body and whatever it is. Because yes, vaccine is important, but I don't know, my question is that, like example, if we find that many people already grow their antibody or something like that, still we need vaccine. What your actually opinion on that particular point?
Okay.
Yes,
Mark.
Yeah.
Oh, I'm sorry, Doctor, and then Mark.
I mean, Sharif, it was just coming into my mind, and I was to speak about that only. So you asked the question. I think this is a very good question. So if we talk about that, when the vaccine is coming, it may be the next week, it may be the next year. My thinking is, I think that till the time we made our artificial vaccine, the nature has already produced vaccine that is in each and every individual. Because in India, if 40-50% people they will be infected, I'm not talking about the test positive, infected with the virus, may not be some people, they are not getting the test done. So if this much of the population is getting infected with the virus, then naturally they are having the vaccine, and I would say the natural disease will produce more antibodies, give a good and effective vaccine as compared to the artificial vaccine.
Okay, Mark, that's a lot to digest. How are you processing it?
Oh, I was processing it, trying to listen to it, trying to learn as you are, Bill, and trying to figure out what to do. But I know that I'm going to wait for the results of the vaccine before even trying to get that vaccine, because I want it to be at least relatively safe. That's the way that I'm taking that attitude and everything, because I want to make sure that it's tested and all of that, and it's been thoroughly tested. And one of the things that I have the advantage of, if you want to call it an advantage, is that many moons ago, I used to work as a contractor at one of the major pharmaceutical companies. I was doing shipping and receiving. So I had some friends that were in the clinical research field. So I'm also watching how it's being developed, because as one of the doctors just alluded to, it's being developed in different areas. I mean, we've got the major pharmaceutical companies that are trying to develop. We've got the smaller pharmaceutical companies, because one of my friends actually moved to one of those smaller companies. And then we've got the universities trying to develop it as well. And there may be other players in that development game as well. But I'm just following the procedures, following what's going on, and trying to learn more about the development of that vaccine before I'll even bother to take it. I am of the opinion, like many of the doctors have said today, that a lot of these things are in our body and that we have our own natural immunity. So I'm also trying to do things to help develop that, whether it's changing my diet, whether it's, I heard earlier, because I was listening off stage, that some people were recommending fruit and vegetables and other things that I try to have in my diet anyway, but I'm trying to increase those and do that in a more healthy way. So that's the way I'm processing this.
Okay. So I guess that raises an issue. Okay, Dr. Sanjay, and then I'll follow up with a question. Go ahead.
Yeah, I have a comment to make here. Now, regarding the herd immunity, even if the herd immunity develops and most of us are safe from the virus, we would still need the vaccine, because there is a small group of high-risk people which are, which may not develop the herd immunity. For example, the old age group, comorbidity, obesity, for example. So we'll need the vaccine probably for only the high-risk people or those who are at high risk of exposure to the things. So the vaccine trial should still go on. The vaccine research should still go on, despite the fact that we are kind of getting a herd immunity and we're building up with the safety.
Okay, because all three doctors, I wanted to direct this to you, and that is because Mark raises an interesting point, and it's been a matter of some debate and discussion, at least here in the United States. People are skeptical about taking any vaccine that's been produced because they have concerns. It was either rushed, not effective, or it's fake. Now, if there is a vaccine, how are people to evaluate and know that it's effective? Because a number of people are taking a wait and see approach to let others go first, as kind of like human guinea pigs. What are your thoughts on that kind of arrangement? And Dr. Ramesh, I'd like to go with you first, because it's really a confusing time. Some people are going to wait. Some people fear that they're going to look for the outcome. So, Dr. Ramesh?
Sir, actually, in the case of vaccines, this thing definitely, as Dr. Sanjay ji was telling, we should have a clear policy to whom we have to prioritize, how to start these and how to give these things. And of course, we should be very much careful about the side effects, because each vaccine has got, because in the grassroots level, really, in the if you apply it, then only you will come. Whatever theories, whatever lab atmosphere we are trying all these things, once you do it directly in the population, then only you will be able to know the side effects or the effects also. I think that we need to prioritize the groups, health workers, and more exposed people, and then as a we have to plan a strategy and then do things. This is what I have to tell about this.
Okay, Dr. Sanjay.
So, given that a vaccine is effective, there will always be people who will be early adopters, and there will be people who will be late adopters now. So that is more of a human nature and a human behavior, and we cannot alter that too much. But yes, more and more people use a vaccine, the more effective the vaccine results show in the population, the more will be the acceptance of that. And we'll have to again wait and watch. And this is something which we cannot force on anyone. For example, like there's some people who don't want to wear mask, knowing fully well that mask is something which is really protective, we can't force it, And vaccine will be even a step further, because that will be purely a voluntary choice of a person to take vaccination, not to take a vaccination.
Okay, Dr. Sagu.
Yes, well, I totally agree with them, as rightly said by both of them, that the vaccine has to be prioritized first. We should be picking up the categories of the people who need first, maybe comorbid patients, maybe obese patients, maybe with the low immunity. But along with that, I would like to highlight one thing, that whatever part of the virus is present in the vaccine, whether it is a complete virus or it is a spike protein or it is a RNA or the DNA, whatever part is there, all these parts, they can create or they can develop some sort of inflammation, because this is the natural pathway of any type of virus infection. What they do, the part of the virus, they causes inflammation, they causes secretion of the interleukin or the cytokines, and though they cause the inflammation, and we develop the symptoms of the disease. The same thing can happen if these vaccines has to be given in the patients with a low immunity, like the patient with a comorbid condition, obese, or any other with the low immunity. So definitely these vaccines can initiate some sort of inflammation that will come under the side effect of the vaccine. So we should be very cautious giving this vaccine, whether they are effective or safe. So in that case, we need to analyze the data, and if the data support that it is a safe and the effective in these group of the people, definitely they should be given. But safety is very important before going to effectivity.
Okay, Mark, you had a comment or a question.
I had a question. I was actually reading an article recently, and it seemed to have some flawed logic, but I would love to hear the doctor's comments on it. It was actually talking about the lockdowns that have gone on around the world. And in this editorial, the person that was writing it was trying to make the point that they felt that the lockdowns were too fast and all of that. But to me, it seemed to me that one of the things that they said, because they used the late 1960s flu as well as the Spanish flu as examples, and they seem to think that and they use Woodstock as an example. They were saying that nobody tried to shut down the Woodstock Music Festival. But as I thought about that, I was thinking that a lot of the things, because we weren't as global back then, so there wasn't air travel was a luxury, and it wasn't as well spread out and things of that nature. So it seemed to me that it was a very flawed logical argument, but I just wanted to know y'all's take on that, because I'm thinking that we did need to do the lockdown, but they were trying to make the point that they thought it was rushed too fast. So that's my question.
So we have the lockdown. Doctors, Dr. Ramesh?
Why I was putting this point, because specifically in the earlier days when we were observing, when the vaccine experiments were going on, there was a specific terminology used always in almost all our articles. It was about cytokine storm, because the moment the virus enters, there is a lot of immune responses happens, and a kind of cytokine storm. Cytokines are actually to protect our body, but without control, it's a kind of storm which actually totally destroys the system. And that was the reason that they were not able to develop the specific vaccine for. Because of the cytokine storm, it is totally a conflict. But later on, slowly in different stages, they tried to manage it. That was the reason that I am still very much afraid of the side effects of this vaccine and all. So definitely we need to seriously go very seriously step by step, taking considering all these aspects. This is the point I want to.
Okay, Dr. Sagu, sequestration and lockdown. What are your thoughts?
Yes, lockdown has spread very fast, and all the countries, they actually seal their boundaries. The air traffic is also being sealed, and as the Mark was comparing the earlier pandemics, or we can say the sort of pandemics, and comparing with this type of the pandemic, yes, definitely, this time it was a luxury. It was a luxury for this virus. It was a luxury for this virus to travel through the air, and the spread was very fast. And because of we have lot of luxuries now, the spread was very fast. So that is why this time the number of the patients is also on the higher side, and even the mortality is also on the higher side. And each and every person of the globe is speaking the same way. So that is why it is a pandemic. Yeah.
Okay. And Dr. Sanjay?
So if you take the example of Spanish flu, although the air travel was not very common in those days, but even in those days, this spread happened for the same reason. There was a movement of diseased people. There was a world war going on. The soldiers who got infected, they were moved from the front to the hospitals, to the army hospitals and back home. So it is the movement of young people who were otherwise healthy, but they got infected. That's what was taking the infection far and wide. And that is the reason why the pandemic happened. The second wave happened again because the second round of the war movement and so it is a soldiers movement. So taking a clue from that, it has been decided by the agencies and authorities that the movement has to be stopped, so the lockdown has to be imposed. And also the early the way in which China dealt with it in Wuhan by imposing a very strict lockdown and trying to curtail the infection within that city and cutting down the spread. Also kind of was an example for the rest of the world to follow. So the lockdown was imposed. Lockdown, whether it was effective, whether it happened too fast, whether it was lifted too soon, it is all very conjectural. But the objective of lockdown was not to stop the infection. It was to stop a rapid spread so that the medical system, the medical facilities are not overwhelmed with a large number of patients, so that the patients keep pouring in slowly, and they are treated and they become okay, which to some extent has the purpose has been fulfilled also, at least in India. Because in India, though the numbers are very, very high, but the recovery is also equally fast, the mortality is low, and because the Indian government, they bought time in the lockdown period to build up the facilities to be able to deal with the patients and to have a proper protocol in place, and also the knowledge was also widespread. So we learned from the European experience, we learned from the US experience, and we have used that experience and that knowledge here in India. So I would say that lockdown has been at least helpful to some extent, if not in totality.
Okay. And that leads me to a follow-up question, and that is this: we'll go around the panel, and this is what I'm just kind of confused about. Why is it that we are accepting this notion that we can, and that it's a good idea to impose a mandatory lockdown on people, and they have to abide by those rules, and we all commonly accept that, except when it comes to a mandatory administration of the vaccine, we seem to hesitate. Why wouldn't we, once we have a vaccine, force people to take the vaccines? It seems to me that's the same as the government ordering people to be locked down. Now, is there a medical reason why we shouldn't do that, or is there some other reason why we shouldn't do it? But it seems to me we should. If we can order and have the authority to put people in quarantine, why can't we force them to take the vaccine?
So I'd like to answer that first. Now, let us take a hypothetical situation. Suppose when this pandemic started, if at that point of time we had a vaccine which was effective, then I'm sure that the government, if they had the logistics, if they had the wherewithal, they would rather impose a compulsory vaccination than lockdown. Because we did not have a vaccine, that's why lockdown was imposed. No? And I think once the vaccine comes up, by then maybe a large number of people will be immune on their own. And vaccination would be required for a smaller fraction of people. And the government may go for a compulsory vaccination for some people at least. For example, say the healthcare workers. No? The government may mandate that yes, healthcare workers, the defenses, the police may have to go compulsory vaccination, whereas a lay people, a common man, there may not be any compulsion for them.
Okay.
Yeah.
Okay. Doctor, yes, Dr. Sagu.
Yes, well, first of all, I would like to comment upon that the lockdown is it's a time buyer, right? So that you can make strategies, you can build up your medical equipments, you can build up your healthcare workers, manpower, and the hospitals, beds, isolation beds, and everything, and even the rations also, and other things also, so that is essentials. They are needful during the lockdown. Right. Number two, as rightly said by Dr. Dhawan, because at that time our enemy was very, very unknown to us. We had not isolated the virus at that time. So because it takes time to isolate the virus, and if you can isolate the virus, and after then you can think of the vaccine. Making a vaccine, developing a vaccine, it's not a short span of time. It takes around a lot of time. So the lockdown was imposed first so that we can be prepared for everything, whether it is a healthcare, whether it is a vaccine, whether it is a other thing. So the first lockdown is important, and after the lockdown, when we can curtail or isolate the virus, then after that we can think of the vaccine development, then vaccine trials, and then we can send the vaccine for international trials.
Okay, but I guess my question is more specific, and I know it's pushing the edge here. And please, doctors, I want to know, once we have the vaccine, why can't we make it mandatory? If we can make lockdown mandatory, and we can, make sequestration mandatory, and we can restrict travel, why, when we finally do have a vaccine, can't we simply order people to take the vaccine? Ain't it?
Yeah.
So I think the answer would be with the doctor. But I just wanted to mention that we can't even mandatory the mask basically. So vaccine is something beyond mask, and I think the rest doctor can answer definitely.
No,